1988, my English teacher stood up in front of the class and told us about his treatment for bone cancer, interferon, because at that time you could get fired if people knew that you had HIV. Like so many people in the 80s and 90s living with HIV, he didn't make it to effective therapy. That's had an impact on me, and I've kept a singular focus since the age of 17 to make an impact in the lives of people living with HIV.
One of the things I'm proudest of during those horrible times was that a group of us medical residents, frustrated beyond belief, decided that if a dignified death was the best we could manage for our patients, then that is exactly what we tried to give them. We set up a nightly death watch rotation. We'd share the names of those who were most likely to pass that night, and then we'd take turns spending the evening at the bedside, doing what we could to make their deaths gentler, and always being there at the very end to provide support and to hold their hand.
The AZT story occupied every minute of every day. It's just, we've got this. We're the only people that have something. We've got to do it right. We've got to get it out to people. We've got to save lives.
I still remember hearing about the first cases of HIV-1 towards the end of 1991. I was 14 years old at the time, and I was struggling with understanding and accepting my own homosexuality. And what was called the gay disease seemed to come as a curse to my own self. I remember vividly deciding at the time that I would dedicate my life on combating HIV.
I can still remember one of my special patients who used to refer to me as her angel. And it's only because I used to hold her hands and I used to tell her that she will be okay. That hope in her eyes and her will to live is what convinced me to stay with HIV.
In 2000, I started working as an intern in a hospital in Cape Town. And by this stage, I'd seen thousands of people die from HIV. I met a patient that had a real impact on me, an older man in the hospital that I worked at that really was there for end-of-life care and the end stages of his disease. There was no therapy. One day I had to take blood from him. I got a little bit emotional because I knew he was basically dying. And I got a bit teary-eyed, and he said to me, he took my hand and said, "Don't worry, doctor, it's not sore." And it's a moment that'll always stay with me.
For many years, I took care of my partner's best friend, but he was more than just a patient living with HIV. He was our permanent plus one. One night I was walking with him on the beach, and he said to me, "I want you to make me a promise. I want you to promise me you won't forget about me. I want you to promise to remember that people still die from HIV."
The person I want to talk about is a young woman that I started looking after in the early 90s who was extremely unwell with HIV and AIDS. And we'd had those conversations about dying. We had a lot of consultations together. We were trying to keep her as well as possible. But we got through it. She then became pregnant. We managed to take her through this pregnancy, and I remember the moment when I told her that her child was free of HIV, and it was a hugely emotional moment. And that really just illustrated how far we'd come and how quickly. And in fact, I still look after her today.
And so now fast forward to 2021, and here we are. The science, the progress, how far we've come, that these lives aren't being lost any longer.
There's been, such a tremendous transformation of this horrible disease from something where it was nearly uniformly fatal to now a disease that we can control with treatment. And so I'm proud to be a part of, this medical miracle.
People can take one pill a day if they're HIV positive and be perfectly healthy and have a normal life. But we can do better.
And that's why we won't stop.
We won't stop. We won't stop.